Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Ruth Roberts, who has supported thousands of dogs and cats to overcome health hurdles like kidney disease, GI illness, allergies, and cancer. Her natural approach to healing creates a gentle yet effective path for your pet to take on their journey to well being. Dr. Ruth created the original crockpot diet, a balanced, home cooked diet for pets, as the foundation of health. Dr. Ruth will help you develop a health plan for your pet via e-learning videos on a range of health topics and one-on-one coaching. Welcome to the show, Dr. Roberts, and whoever you
Hey,
have with you here.
and this is Hayo. Thanks very much, Dr. Stephanie Gray. It's such a pleasure to be with you. So, yeah.
Well, tell us your story. How did you become, as they call you, I know you say on your website, your pet's ally, and kind of learn to blend functional medicine methods for the caring of animals?
Like a lot of doctors, it took me getting sick and realizing that there just weren't good options.
Sure.
So I was very fortunate to find a functional medicine practitioner in South Carolina, where I was living at the time. And the help that he was able to give me was just unbelievable because I'd seen so many of my own clients come in with IBS, with fibromyalgia, things like that. And it was horrible because I watched so many of them be turned into junkies. So they started on NSAIDs and then they got, pushed
Hmm.
up and up and up into narcotics. And I knew I did not want to go that route. So I was really, really fortunate to find this doc, and that made me open my eyes and realize that, if it's working for me, if simple things like
Hmm.
changing your nutrition, um, eliminating certain things from your diet would had such a profound effect for me, what would it do for pets? And interestingly, at the same time, I had started studying acupuncture at the Chi Institute in Reddick, Florida. I had a dog that had bacterial endocarditis,
Wow.
and yeah, and that's pretty ugly stuff. Most dogs, unfortunately, die from it. Thankfully, she got through it, and it was sort of not as severe a case as some other pets. But what they told me is, okay, start cooking for her, and use these herbal formulas, do these acupoints. Well, she had wanted nothing to do with acupuncture, but she thought the idea of home cooking was fantastic. She took the herbs. We went through conventional therapy as well, and she contracted this at 9 and lived to be 13. So, I mean, that's
Wow.
just, crazy amazing. But that's what convinced me. We really have to start with the basics with pets.
So you were having your own health challenges when you were already a vet, and then you kind of applied them to animals, your animal in particular, and then to,
Exactly,
okay.
exactly. Yeah, and that's exactly it. So I started out, trying to fight my way back out of fibromyalgia, and the more I learned, the more I'm thinking, golly, this is stupid. Why am I not
Mhm.
doing this for animals?
Yep.
So that's exactly it. I learned how to translate it to help dogs and cats.
And that's really why I'm so excited about this interview because I also kind of felt stupid like, well, gosh, I'm earning my living by helping other patients rebuild their health. But yet I have this dog at home who's probably eating crappy food and I'm not really applying any of those principles to her. And so I was just excited to meet you and obviously excited for this conversation. So let's talk about food. Let's go there. I've had other veterinarians on the show and they've given great information to our listeners. And I know there's some debate on what the best food is for animals, but I think all the vets I've talked to agree that kibble is not the best, right? It's processed, it's just crap. Can you expand on that? So let's talk about what's not good food, and then we can expand onto what you think good food is.
Right, right. I mean, and that's essentially it. I mean, with kibble, essentially, we're feeding our pets Doritos and
Mm,
what do they call those things? The beef jerky sticks. I mean, that's the quality of the foodstuffs going in there. So I take many of my holistic colleagues are all about raw food. And because I
good.
was trained in traditional Chinese medicine, I learned that cooked food is better because it helps sort of present the digestive system with pre-digested food. And so something that's going to be easy for the animal, for the person to further digest and assimilate. So the argument is that Raw food is the ancestral diet of dogs,
Sure.
and I would argue that it is, but it's also our ancestral diet. And I don't think many of us would do well eating raw meat all the time. And it's so I think there's pretty clear evidence now that dogs, Canis familiaris, diverged from wolves, Lupus canis, something like 40,000, I said it backwards, canis lupus, something like 40,000 years ago. And what happened is that they evolved with us, Homo sapiens. And so first they're eating our garbage, then they're eating our leftovers, and then finally what we fed them. And as our diet has evolved so rapidly since the 50s, really, 1950s, theirs has as well. And we've all gone from pretty much a whole foods diet that would be based on what's available in the region where we're located and into this highly processed, um, shipped thousands of miles just mess that we're currently in. So for that reason, I really think that if we back it up several steps and start cooking for our pets again in a balanced ratio, so roughly one third protein, one third fat, healthy fats, one third carbohydrates, both vegetables and other simple carbohydrates, that really is the best way to achieve health for pets,
Can you say
for
that
dogs.
again? I'm looking at your crockpot diet here, but you said one
Yeah,
third protein, one third
yeah.
is that fat or
One
what was
third healthy fats and
uh-huh.
then one third carbohydrates. So basically, it's a whole foods nutrition
Sure.
approach.
And
Yeah.
how would that compare to kibble?
Uh, Kibble is roughly 65 to 80% carbohydrate, and sadly, it's all highly processed. So it's like, boom, sugar.
Sure. So is that why our dogs and cats are getting diabetes and other chronic diseases? I mean, is that one of the main, do you feel like
It's
reasons? Yeah.
It's one of the big reasons. And here's the really sad thing in our effort to, and this is a segue away from food, but we'll come back to how we can fix this issue. The problem is actually spaying and neutering because we are removing their
Mm,
gonads at 6 months, usually. And so I used to think, oh, it's because they're never allowed to become endocrine competent. Their
right.
systems never develop. It turns out, so the more recent research actually is that the amount of luteinizing hormone that is produced in their bodies is something like 20 to 30 times what it would be in an intact dog or cat. And what happens worse is that all of these tissues that shouldn't have receptors for luteinizing hormone grow receptors, and they're in the brain, the gut, the joints, the immune system. And so, this really is the proposed mechanism for why there is such an epidemic of chronic disease in our pets. And then, if you throw a horrible, highly processed pro inflammatory diet on top of that, it's just a recipe for disaster.
Want to unpack a lot of that. So let's go to the
Ooh.
surgery.
Ah.
We will come back to food, but since we went on that tangent, when I met you, that was kind of one of my concerns that I guess and regrets that I have with my mini golden doodle. We got a puppy right before my husband and I became pregnant, and it was our first child, and our vet kind of pressured us into, you're gonna be overwhelmed with your first baby. You might as well just get your dog, fixed now and not have to worry about it after the baby's here. And I thought, now hang on here. If I have, female patients who go through surgical menopause early in life, they're at greater risk of heart disease, of bone loss, of memory loss, and we'll just say a mood
Cancer?
impact. Yeah, and impacts on mood and yeah, just overall well-being. And so I'm thinking, what's the impact on my dog? And I said, can I delay the surgery? And my dog kind of said, my vet said, you don't want your dog going into heat. You don't want to deal with all that. And she didn't have a lot of input. And now I know my intuition was right. So next time around, I'm going to delay the surgery. But let's stay on this topic. So what is the solution and like how can we best delay these sort of surgeries?
A lot of it is you being your pet's advocate and saying, "Thanks so much for the information, but I'm gonna wait,
Mhm.
for a little longer because I've read this and this and this." And frankly, University of California, Davis started doing started publishing research papers in 2013 showing that there was a link between increased disease of all sorts in pets that are spayed and neutered versus pets that are not. And they started with the golden retriever study and then the golden retriever Labrador study. And then since then, they've been just doing a massive review of all of their patient records and looking, what happens to the endocrine system, what happens with other pets. And those two breeds, Goldens and Labs, have far more disposition to these horrible diseases, but it's the same for all pets,
But I'm pretty
sadly.
sure I was told the latter. I'm pretty sure I was told, "Oh, by having this surgery performed on your animal, they'll have reduced risk of" is it mammary
Yep,
cancer or what?
mammary cancer or breast cancer. Yep. And
So is it
then they have increased
increase
risk of
all the other
hemangiosarcoma, lymphosarcoma, osteosarcoma, all of these really awful cancers.
and are
I mean,
those more
I've,
common than mammary cancer? I mean, if we really break it down, like, are those
oh my
more aggressive,
gosh.
it sounds like, are they more
Oh, it's
prevalent?
horrible. It's horrible. And I am old enough. When I started practice in 1990, 90% of pets were intact. I would rather treat
Wow.
mammary cancer or prostate cancer in males all day long than hemangiosarcoma, lymphosarcoma, these
Mm.
horrible, horrible cancers.
Good to know. Okay, so we need to be our pet's advocate.
Yes.
How long should we delay? Like, for the endocrine system, I mean, to, I guess, get the benefits of the hormones, right? Like, how long do we wait?
Ideally, at least until 5, because that's going to
5,
be
yeah.
roughly equivalent to when we as humans would go through menopause and andropause.
Okay,
Um,
good to
there's a
know.
guy that did the Old Gray Muzzle tour, and he looked at Rottweilers that were 13 and 14 and 15, which is incredibly unusual. None of them were spayed or neutered, and they died with cancer, not of cancer. Does that make sense?
Mhm.
So his recommendation is 5 or Y, unless there's a medical reason to spay or neuter, don't.
Sure, sure. So then, and I don't know a lot about this, but, like, so does a female dog how frequently would a female dog go into heat in those 5 years? Is it, like, twice a year? Or I don't even know what the
Well, and this is the other thing that's weird. It used to be twice a year, and then it got to be once a year, and they got to be older and older before they would go into heat. And I think that is related to the pro-inflammatory diet. And
Sure.
it's something you just have to deal with. It's kind of like having a moody teenager for about 3 weeks, and then it's over. But we lived with dogs in in our for thousands of years that were intact before we started spaying and neutering everybody. So we got used to it. We taught our dogs manners, for lack of a better description, about how to behave around each other with being intact dogs. But it's very difficult in this day and age, sadly.
Sure. So if I my brain is literally thinking, okay, so if I do this for my next dog and I want to take them to doggy daycare, they just can't go during that month. You just avoid, or
Right.
because you can't really monitor. Like, yeah, I can help my with my dog's behaviors if we're out on a walk, but if I drop them off at doggy daycare,
Mm-mm.
then, yeah, so
Nope.
just avoid those sort of.
Right,
Yeah,
and the other problem is this, is that for many of the daycares and the boarding kennels, they won't accept dogs that are intact because their insurance policies prohibit them from doing so.
sure, of course.
Yes, well, and it just
Have to get a dog sitter. There's
yep,
an alternative.
that's the
Get
best
a
option.
yeah,
Yeah,
yeah.
yeah,
Well,
it's
let's
like a group mommy daycare for pups, yeah.
well, the great information. Let's go back to what you feel is the best food, like like literally whole food, in your crock pet diet. So can you break that down and kind of explain what that is?
Sure, so the original crock-pot diet was essentially a variation on some recipes that my professors at the Chi Institute taught me. And as I learned more and more, I incorporated different food sources. But essentially, what it is a lean cut of protein. So the least expensive are typically pork, beef, and then turkey or chicken. If your pet's not sensitive, and unfortunately many are, and then healthy fats, so things like avocado oil, grapeseed oil, healthy vegetable oils that are processed correctly, and then lots and lots and lots of veggies. So things like brassica species, so broccoli, kale, cabbage,
Yes.
other veggies. And then I am a big proponent of using beans because they are essentially slow carbs. So, meaning that the fiber prevents that big hit of sugar from
Mhm.
being absorbed. And then using grains as well. So, rices, quinoa, things like uh, amaranth, things of that nature. And then the more kind of standard issue ones of oats and things like that, rice.
Sure. So
So essentially, that's it. I mean, it's very simple to make. The idea is you put it all in a slow cooker, or if you don't have one, you would use a roasting pan in the oven, big stock pot on top of the stove, whatever is easiest for you to do.
and you have a video, I watched it the other day of literally you preparing this entire thing, chopping your vegetables, putting everything into the pan and cooking it. And then afterwards, I noticed you had your, what's it called when you mix up the food? The
Oh, the immersion blender,
immersion
yes.
blender. Yeah. So you basically broke it all down, and is that so they just won't choke? So the animal,
Well, yes, sadly, actually, we had a dachshund that just was such a pig. She would inhale her food, and so we had to puree it into a pate for her because she choked herself out a couple of times. Our
sure,
cat Pepe would happily eat it, um, as
as
is with
is.
little mixing. Hayo, our little poodle that's with us now, has no teeth, so for her, it's
Mm.
necessary to puree it.
Sure, sure. So I noticed there's some other additives. So you put in turmeric and mustard and even some salt, some calcium, garlic. Can you speak to some of those?
Sure. So the calcium is necessary to balance the diet so that the calcium phosphorus ratio is correct in the protein. And the salt is there to actually increase the chloride level. We add kelp for iodine, and then the culinary herbs of turmeric, mustard, and one clove of garlic, which usually freaks people out,
And it
are
freaked
there.
me out because I emailed you right
Ah,
away and thought, wait a minute here. What
it's
I thought
toxic. Are you out of your mind? And
I
yeah, so it is toxic, but it's also toxic to us. And so, for frame of reference, a 50-pound dog can eat one clove of raw garlic every day without a problem. So, one clove of cooked garlic in 16 cups of food, not a big deal.
sure.
The reason those herbs and spices are there is because in Chinese medicine, they help to move things, they help resolve stagnation. And stagnation in Chinese medicine is what causes pain, cancer, stiffness, so it helps. It's more of a preventive strategy or a long-term strategy.
Awesome. So you basically make a big, huge batch. And then I saw you had these silicone bags where you essentially are freezing some of it.
Right.
How do you heat that up? Is that just over the stove or like
Make it super easy. So basically, what you would want to do is have no more than about 5 days worth of food in the refrigerator so that it doesn't go bad and give your dog food poisoning or your cat, and freeze the rest. And then what we do for our guys is take a measuring cup and scoop out what they need for that meal. And
yep.
then we'll add some warm water to it to warm it up and take the
Oh,
heat off
sure.
of it.
Sure.
Yeah.
So you basically have on your guide here, if you're using pork or beef or turkey with or without beans, like just exactly how many tablespoons, whatnot, um, is a serving. And I know this is more of a complex question, but I did have one follower ask, like for different breeds, like working breeds versus hunting dogs versus like a dog that sleeps all day, do certain breeds need more protein? Or for the most part, is this kind of ratio of the third protein to a third fat to a third carbs, is that pretty appropriate regardless?
It's pretty appropriate regardless. I will say, so one of my long lost buddies, Esau, was an English setter, and that guy would run sun up to sundown. So he needed more fuel. So what we did is we kept the same volume of
Uh-huh.
the food as far as the one third, one third, one third protein, fat, and carbohydrate, but we added extra fat and extra carbohydrates to his each meal to keep his weight up.
Sure.
So I think that's appropriate. I think there's beginning to be some pushback even on the human side as far as eating too much protein
Sure.
causes more inflammation. And
Sure.
so I think the other issue is sustainability. I mean, cats and dogs already eat 25 to 30% of the conventionally produced animal proteins in the United States. So trying to push them all to raw is like going to be a problem. And I think that even now people are having difficulty getting certain types of proteins with consistency in the grocery store.
Sure.
So I think it's really important to be environmentally sustainable with our pets.
Sure. So how do we transition an animal to this? Like I kind of feel like, well, I already give my dog table scraps, which that's another question. Should I or should I not be like doing that? I know from a behavior standpoint, it's not nice when you have company for your dog to beg at the table, but sometimes if
Right.
we have a roast, I feel like that's good meat. I'll give her a little bite. Is that okay? I mean, it's
Yeah, and absolutely. And to avoid the behavior issue of begging, just put it, it stays on your plate and goes directly into her bowl and the bowl goes down on the floor.
sure,
So that
sure.
way that
Don't
way
feed her
she's like, "Oh yeah," from
from
the
the
table.
table. Yeah.
Exactly. Yeah.
Good point. So how
Yeah.
do we transition animals to this? Because I feel like this is more doable than raw food. I just feel like it's easier as well. And I understand
It
it
is.
sounds like the digestive system has their digestive systems have adapted and that this would be easier on them anyways. That's what you're saying. So
Absolutely.
I cook a big batch, right? Am I going to, still give her if what her serving was going to be, am I going to give her half of that with half of her dry food for a
I would
while?
start it depends. So if your pet has ever had any GI issues, I'd start really slow. So start with 75% of what she's currently eating, 25% new, and plan to take 2 weeks to transition over.
Like in the
If
same
she
bowl at the same
Mhm.
time? Just put it
Oh,
all in
yeah.
there and let her okay.
Yep.
Okay.
Boom, yeah, and how much to start with, so kind of figure out what the current volume is that you're feeding. So if you're feeding 2 cups twice a day, then basically you would start with a cup and a half of what you're currently feeding and then a half a cup of crock-pot diet.
Sure.
And then once you get your pet transitioned all the way over to cooked food, to the crock-pot diet, then start to look, okay, is she doing okay as far as maintaining weight? Is she losing too much weight? What do we need to do to make sure that she stays at a good, healthy body weight and maintains plenty of muscle?
Sure, sure. So eventually you just make that transition over and then most animals to your experience do fine.
They
They
do
do
fine.
better.
The
Yeah.
only t
Yeah.
Yeah, they do better. But the only time there's an issue is when an owner's like, "Okay, kibble's out. Let's feed crockpot." Boom. That can create some real problems, some diarrhea and GI issues.
Sure. Now, when I think of like foundational nutrition, well, obviously for humans, that's also real food, not processed food, but I'm recommending for my human patients, right? Multivitamin, fish oil, vitamin D, probiotics, various supplements, sometimes other anti-inflammatories or whatnot. So do animals need these as well? And is this kind of where your holistic total body support comes in? Can you speak to that?
Absolutely. And, the same issue, the reason you're asking your patients to take supplements is that the quality of the nutrients that are available in our food just isn't the same as it used to be because of the current farming practices. So to make sure that the diet stays balanced, it is important to use some sort of a supplement. The things that tends to be most lacking in many of the easy to find dog supplements on Amazon, especially, are going to be things like zinc, vitamin D tends to be a wee bit low, and then choline and vitamin E, especially. It's easy and expensive to get the B vitamins squared away, but these other critical nutrients are often left out, sadly.
Sure.
And the other thing is too with holistic total body support is it contains a lot of glandular materials,
Mhm.
which is part of how I help address the problem we were talking about earlier, the side effects basically of spaying and neutering.
So it's kind of for listeners, what she's saying is giving these animals the glands to support their glands, essentially.
Exactly.
Right. Yeah.
Feed their endocrine systems.
Literally.
Yeah.
Yeah. Yep. Yep.
Yeah, and then the same list of nutrients. So omega-3 fatty acids are going to be super important to add in, and then we add other supplements based on what health conditions that pet might be experiencing. If they have a terrific amount of inflammation going on, omega-3s help tremendously, but we might add some turmeric, we might add some ginger, we might add quercetin actually.
I'm glad you said that. But let me before we go to those, let me come back to holistic total body support. So for someone
Sure.
who hasn't converted over to the crock pet diet yet, like me, right? You gave me some of that to try on my animal. You can sprinkle it over the kibble, little
Mhm.
the scoop, whatnot,
Yeah.
or if the animal doesn't, if the animal won't eat it that way, how else, like, would you just give it with some sort of snack or treat or peanut butter or something like that?
Right, you could do that. And the other thing is too, is that, I mean, it seems daunting at first to start cooking for your pet, but if you do nothing else than go out and buy a bag of frozen Normandy blend vegetables, so essentially some yellow squash, broccoli, cauliflower, I think that's what's in that mix, and take a quarter cup, boil it up with some water to cook it through, put that on top of your pet's food and mix the supplement in with that, it will disappear pretty quickly.
Mm, start with the vegetables. At least you that's
Yeah.
good, good, good advice. So certainly you can give your dog the or cat, your animal, the holistic. Well, let me clarify. This is for dogs and cats,
It
right?
is
And
for dogs
okay,
and cats.
okay.
It is the only supplement on the market that has enough taurine for cats and actually enough taurine for breeds that are predisposed to heart disease.
Wonderful. Okay. So let's go back to those other supplements because there was actually a post on Facebook a while ago, someone asking, what do I give my dog to support their joints? And, shy of me just referring them to you, I said, well, fish oil, you can give your dog, omegas, but how much? So, I mean, I don't know how to,
Minimum
yeah,
minimum dose, so minimum dose to balance the omega-3 to 6 ratio, just so the omega-6s are the pro-inflammatory ones, the omega-3s are the anti-inflammatory,
mhm,
and that's a gross oversimplification, but to get them into balance, you would give 100 milligrams per pound of body weight of omega-3 fatty acids. And
okay.
then the doses, and actually, this is one of the few places where veterinary medicine has done some research. And then for dogs that have arthritis, for instance,
Yeah.
the dose there is almost 300 milligrams per pound of body weight. So it's a
Wow.
pretty massive dose. Yeah.
Okay. What about turmeric? Like,
Yeah, I mean, turmeric. It's really here's what's really interesting though. Recently, so turmeric you can give anywhere from um, around 20 milligrams of curcumins, especially for your average 50-pound dog. What
sure.
I've been finding recently, though, is that a lot of dogs actually have GI sensitivity to turmeric because everybody's using it in everything. Like
Hmm.
it's in every supplement of the world right now.
Sure.
So what a lot of people have been finding relief with is actually quercetin.
Awesome. Yeah. That's wonderful. So how do we dose that though?
So actually, if you head over to the website, there's a product I have called Histopause, and the
Awesome.
dosing chart is there. But in a nutshell, for 25 pounds and less, you'd be somewhere around 75 milligrams per day, and then sort of escalates up from there. And it
Awesome.
is, it can have some GI upset, but that's pretty infrequent.
Yeah, quercetin, I think these last few years of all years is finally gaining some hype, and that it certainly supports our immune system. It's a zinc ionophore, it can draw zinc into the cells, antioxidant, great for allergies, I think, as you were alluding to.
Yes.
It's just wonderful. Uh, on the topic of nutrition and nutritional deficiencies, I have a question about my dog liking to chew grass. Is that just something she's doing to soothe her potentially upset stomach, or is she just playing? She's always eating grass. Like
Well,
there's
I think there's a myriad of reasons, and so one is, she's getting some minerals and things of that nature out of the grass.
sure.
The other is she could have an upset stomach. I mean, that's sort of the standard issue answer.
Yeah.
And then, interestingly, there's a product called Phytospore made by
Yeah.
Megaspore
Sure.
Biotic folks, and it includes Pediococcus, which is an organism found on grass. It's a probiotic organism found on grass. So she may be trying to inoculate her gut with something that will be helpful. But I think for many, many pets, it really is to help get some fresh green into their diet
Sure.
and to balance, add in some more minerals and nutrients.
Awesome. And all these products are on your website, and we'll direct listeners to that at the conclusion of the episode. So I
Right
want
on.
to go on to maybe another controversial topic, vaccinations. So, there are many humans, my patients are now choosing to, be selective with what they inject into their body. And I, again, with my animal, I kind of didn't think twice. I just took her to the doctor and they just, give her all her vaccines. And she has gone to doggy daycare, as I had mentioned. So I thought, well, I'm supposed to get kennel cough and, whatnot. But in the back of my head, I'm thinking, could some of these have adjuvants or some toxic ingredients that are going to obviously accumulate as part of her toxic burden that could be, we'll just say, shortening her lifespan.
Yeah,
So I know you have some techniques to kind of minimize some of those effects, but can we talk vaccines for a minute here?
sure.
Kind of what you believe the core and the non-core vaccines are. I want to talk about titers and again what we can do to minimize adverse reactions with vaccination. So I'll let you kind of take it away.
Right. So this is, and this is the problem. I think both on the veterinary side and the human side, there's not a rational discussion about what's necessary for vaccines. So, you know, vis-a-vis in New York City, and there are people that have a case of polio. And to me, this is horrifying. My father had polio and he suffered all of his life with it. How did this happen in the US? And it's because you're this way or you're that way, and there's no really rational guidance in between.
Sure.
So for pets, we actually have some. It's amazing. In 1990, a guy named Ron Schultz published the first study that said, lo and behold, the duration of immunity is actually 3, 4, 5 years in many cases. And what that means is that when your pet has received a vaccine and been boosted appropriately based on his or her age, then that immunity lasts for X number of years. So the thing and that study came out in 93, just as we were understanding that vaccines were causing fibrosarcomas in cats, and everybody was like, "Oh, what do we do?" So it turns out that the idea of core versus non-core vaccines was developed by the AVMA, the American Veterinary Medical Association, and the AAHA, the American Animal Hospital Association, to help guide practitioners about what vaccines really are necessary, how
Sure.
often to give them, things like that.
Yeah.
Unfortunately, most of my colleagues don't follow the recommendations. So I think for puppies, it is important to receive a distemper parvo vaccine, but not until 12 weeks, because that's when the maternal antibodies drop enough that the puppy can start making its own antibodies to this
And
vaccine.
and I don't even remember, are they normally given earlier than that?
Yeah, I
Or
mean,
yeah, yeah.
many breeders and many veterinarians will start them at 6 or 8 weeks, when the chances of having any beneficial effect to the puppy is pretty slim to none. Plus, the distemper portion is immunosuppressive, which can create a whole nother bag of wax. Yeah.
Well, can you tell us what distemper and parvo are too quickly? Just kind of
Sure. Yeah. Yeah. So distemper is a neurological virus, and it's horrible to see. It creates seizures and all sorts of really awful effects. And sadly, something like 92% of patients that contract it die from it.
mm,
So it's ugly. Thankfully, since the 50s, it's been around since the 50s, and it used to come through and just wipe out entire towns of dogs. But because this is something we've been able to protect with vaccinations, we rarely see it anymore, thankfully. Parvovirus is something that started up in the late 70s. It is a virus that attacks the lining of the intestines and basically makes the entire inside of the intestine slough out through the body. And so this poor puppy is then has this horrible diarrhea, and it becomes very
mm,
bloody because literally the inside of its intestines is coming out.
sure.
So it kills a lot of puppies. It's a really awful, awful disease. I used to, when I was first in practice, sorry, Hayo's coming back. When I was first in practice in the summertime, I would be treating 30, 40, 50 dogs in a week easily. And it's horrible. These guys suffer. Ugh, yuck. So that's why, and so distemper, not very common out there anymore. It is in certain areas, and and you can actually go online and Google incidents of distemper and get
Sure.
maps to show you, okay, is this really a problem area or in my area, or is it not? But parvovirus is a problem everywhere, and you there's a that's why this is such a you because it's so ubiquitous. It's very important to make sure that your dog is protected. And for puppies under 12 weeks, and actually under 16 weeks, I recommend not taking them to public areas until they have some level of protection
Sure.
with the vaccine. Yeah.
Sure. So this may sound like a silly question, but you know how there are people who um, get the flu vaccine and they still get the flu, and maybe that's because the vaccine was a different strain than what they actually contracted was or whatnot. With these, with distemper and parvo, i- are they really getting vaccinated for the likely strain they're going to be in contact? Like, is there one parvo and one like? Does that make sense?
There is one distemper. There
Okay.
are a few different strains of parvo, but the vaccine seems to cross protect
Okay.
against all of the different strains, and it has been for
Good to know.
20
Okay.
years. Yeah, 20,
That's
30 years.
sure.
So
Yeah.
that's one, not a problem. Now the canine flu vaccine is similar to the human vaccine, and I think it's pretty close to worthless.
Okay, okay. Well, we'll just skip over that one. There we go. Okay.
Yep,
Obviously, rabies is probably next on the list, so let's talk about that one.
right. So, again, rabies, if you or your pet gets it, it is 99.9% fatal. It is, and then before there was a vaccine available, there were animals and people that died of it with great frequency. In fact, if you watched Old Yeller, that's what hydrophobia is rabies, and
Mm,
it's pretty awful stuff. So it is important, but it's important to do this vaccine, for puppies somewhere around, the 14 to 16 week mark
okay,
once they've got some of these other vaccines on board. And that's
sure,
what I would always encourage people to do is to separate the vaccines out to do a couple of things. One is so that the puppy or kitten can actually develop an immune response to the things that it has been vaccinated against.
sure.
And the second is to use some thuja and help, which is an herb, Western cedar. It will help the body get rid of any toxins. So, some of the adjuvants, the things that make the vaccine work better, some of which are great, some of which are not so great. But it helps to clear the system of all of those things
So
so
how do
that
we tell us about that thuja? How do we dose that? How do we give that? Like immediately
that's
after the vaccine? Like just
right. And there's
okay.
there's two approaches. You can go with a homeopathic version like the 30C, excuse me, and you would give that at let's see, I think that's a pellet per 10 pounds daily for 5 days. And then the way I prefer to use thuja is with the actual tincture or uh, the mother tincture, if you will, and give that at 1 drop per 10 pounds twice a day for 5 days.
Okay.
And I would start that, right when folks get home from the
Yeah.
vet. So, yeah,
Great. Good, good, good. So let's also talk about titers. So
yeah,
that was also something that I brought up to my vet. Like when they're just kind of pushing all these vaccines, just kind of following protocol, I thought, well, hang on here. I'm happy to pay for a titer. I want to know if my dogs actually do. So are you pro titer and kind of tell me your thoughts on that?
absolutely.
Yeah, yeah.
Yeah. So this has been and again, Dr. Schultz, when he published his paper on the duration of immunity, he started trying to educate the veterinary profession about titers then, back in 93. And so a titer is a blood test. And essentially, what we're doing is seeing if the dog or the cat has an adequate amount of antibodies in its bloodstream to protect against a certain disease. And it is, it's bizarre the things my colleagues end up telling their clients, but it is more expensive than getting the vaccine done itself. But if you don't need to vaccinate your pet, isn't that
Right.
better to know that up
Right.
front?
Yes.
And yeah, and so titers will drop with age. So, for instance, our cat Pepe is 13. Um, his rabies titer dropped about 3 years ago, and I needed to booster his rabies vaccine because that's just one of those things you just don't mess around with. The difficulty is that if the distemper portion of the distemper parvo vaccine, if the antibodies drop against that, but not the parvo, it's difficult to
Yes.
find
Yeah.
just a distemper vaccine.
Sure. Sure. So can you? I don't even remember. So how long are those vaccines usually like scheduled? Are those like yearly that they're given animals? And could titers
So
actually last longer, like 3 to 5 years? Or
So this is the other thing that's really heartbreaking to me is that um, the schedule I would follow is for puppies and kittens. First vaccine at 12 weeks, second vaccine at 16 weeks, and then rabies either at 14 weeks or 18 weeks. And then in a year, you would booster again because they really have not had an opportunity to develop a full-fledged adult immune response to these viruses. And then after that, then we would say, okay, now this vaccine is good for 3 years, and then we would start doing titers. The sticky part is for the rabies titer, um, because a lot of cities and things of that nature want you to get a license for your dog, and that license is tied to a current rabies vaccine.
Not the titer vaccine that
Yeah,
has, yeah.
yeah, yeah.
Shoot, shoot. You also mentioned something on one of your videos about non-responders. So if you have an older animal who's, you titer them, but and they're not creating antibodies that they had maybe earlier in life, but there may be a low risk animal, like they're not going to doggy daycare or whatnot. Like, can we back off on with, continued vaccinations on some of those animals?
Yeah, and really non-responders can be at any age. So
Okay,
for
okay,
instance, we might have a dog that's now 3 and we gave it its puppy series, we boosted it at a year, and here we are at the end of 3 years after that last vaccination. We take a titer sample and there's no antibodies. And then we're like, oh, okay, well, we need to booster this pup. We booster the pup, we check the antibodies a year later, and they still don't have antibodies. So what that means is that that particular dog's immune system has not been able to form specific antibodies against those diseases, but it may be that the sort of innate or general immune system is able to help fend things off. We don't know because there's not a way to test for it.
sure,
But I think it's reasonable. So for a 13-year-old cat that stays inside only, is it reasonable to consider backing off of the vaccines? Absolutely. The one codicil is rabies vaccine, but there's a it's it's just so ridiculous sometimes. So the rabies compendium in 2016 said that if the pet has ever been vaccinated against rabies, it's considered up to date if it bites somebody, and then the Department of Health may ask you to vaccinate again after that.
hmm,
So it's if your vet's giving you a bunch of flack, you might download the rabies compendium and
sure,
read through about that, and then show them that particular
yeah, yeah,
page. Yeah.
sure. Let's talk about some of the non-core vaccines. Now, I keep mentioning my dog goes to doggy daycare, whatnot, and so I know they ask for kennel cough. Is that Bordetella? Is that yeah,
That's Bordetella bronchoseptica. Yeah, and there is an intranasal version of that that actually is effective. The injectable one is absolutely worthless, and then there is another one that's given orally, and it's kind of got mixed efficacy.
good to
Um,
know. So, I mean, I know kennel cough's highly contagious, but it's not life-threatening. I mean, is it really? I keep coming back to, yes, I know they're asking for it, but is it? I don't know how bad it is. I guess I'm asking your opinion. Is that one really necessary?
well, think about it this way: it's like getting whooping cough, and so it's going to take you a couple of weeks to get over it. And the problem is that for some animals and some people, the long-term effects on the respiratory system can be quite profound. So, for instance, that in humans, whooping cough might induce adult onset asthma, and then you
Sure.
have to deal with that for the rest of your life. The other issue is from the standpoint of the boarding kennel. How horrible would it be to have 20 dogs turn up with kennel cough?
Mm.
Yeah, and that's the issue, and it's
Yeah, I
not
get
fun
it. Yeah, yeah.
because it's like having a sick kid. The poor dog's up coughing all night. They have to take antibiotics, et cetera, et cetera. So
Can you
to
titer
me,
that one too, though? Can you do titers
no,
on? Oh,
unfortunately, it
shoot.
really does not last much more than a year. But to me, to give an intranasal vaccine where the majority of the immune system work is going to be done against this bug is
Sure,
a better idea than having to deal with it later.
sure. What about lepto and Lyme? So those are a couple I gave into as well. At the beginning, I thought, well, my dog's outside. There are ticks here. Like I'll do the lepto Lyme. But now I'm thinking, isn't she also taking oral medication for Lyme and ticks? Which I want to go there next. But let's stay on the vaccine topic for a moment
Because it's
here.
so much fun.
Like,
Yeah. So this is where if you Google incidence of leptospirosis and get a map, you can
yeah,
see,
yeah,
is this a problem in my area? Is it not a problem? The weird thing, and lepto is also not a very fun disease. It can cause kidney damage, it can cause damage to the liver, it can cause GI disease. The interesting thing is that we don't know if the serovars, the portions of the lepto vaccine, are actually effective against the particular bacterial species out in the wild. And so, if your dog develops acute kidney failure, even if your dog has had a test for leptospirosis, they're going to say, well, or a vaccine for leptospirosis is what I should have said. They're going to say, well, we should test for it because your dog may not be protected.
okay.
So, leptospirosis is also the vaccine that tends to create the most side effects.
Mm,
So I tend to not give it.
okay,
Now, if you lived in a really, really, really hot area, meaning there's a lot of leptospirosis, it may be something to consider. But I would
sure.
give it away from other vaccines. And in fact, Dr. Schultz, and he had to tone his message down because the vaccine manufacturers kind of got after him. But at one point in a meeting, he said, "This is what you really have to do to make sure your dog's protected." And almost no one does it, and that is finish the puppy series and then give a lepto vaccine, repeat that in 3 weeks, repeat that in 3 months, and then give it every 6 months. And virtually no veterinarians are giving it every
That
6
much.
months.
Yeah, yeah. No,
So
thank you
that's
on that. Yeah,
that's part of the problem. Is it really that the vaccine is failing or is it just not given properly?
sure, sure.
Now, Lyme disease, that is a whole nother bag of wax. If your area is endemic to Lyme, but also to other tick-borne diseases like Rocky Mountain spotted fever,
Mhm,
ehrlichia, anaplasmosis. Dogs get those too. And
mhm.
so if we give a Lyme vaccine and say, "Ha, no worry," that's not the case. So what we really have to do is good tick control. And I think in the Northeast where Lyme started, basically, there's a split among practitioners there. Do you vaccinate or do you just really, really focus on tick control?
And do you
And
just
it's
mean
pretty
like every day check your animal for ticks? Is that what you're saying, basically? Or
not necessarily. So this is where I would make a case for something like a flea, some sort of external flea and tick
oh,
control.
sure,
So
got it.
literally like a Seresto collar, a topical treatment, something of that nature. And there's things like Wondercide, which is a cedar oil spray. I mean, there's a myriad of other options. The more natural you go, sort of the more effort it takes to keep things under control. So you would like if you use Wondercide or some of the other essential oils, you may need to treat every 12 hours.
Sure.
So it's just a matter of how to balance things out.
I think one of my patients said if that's like a spray, she said she sprays the underside of her animals before they go on walks every single time.
Yep,
And maybe that's what it is. And she's like, it works great. But
it does work well.
yeah, yeah. Okay. So let's actually on that topic go to kind of the flea tick, but I also want to talk about heartworm medications. um, and then we'll wrap up the show.
Okay.
Because well, one, I had a lot of questions when I posted on Facebook. I mean, that was one of the top, other than what do I feed my animal, right? The next question was, what are alternatives? And you kind of are already going there with this caller. So let's stay with alternatives for fleas and ticks first. And I guess, can we maybe before we talk about alternatives, let's talk about if you're kind of for those medications or not, because one one patient wasn't a patient, it was a follower in particular had said that her dog had some sort of toxicity in the back of his eye from commonly prescribed medication, and her vet said or the eye specialist for her animal said they see this all the time as a side effect. I don't even know exactly what that was, but that made me start thinking, well, what are the side effects of all these medications that I just give my animal every month, right? Without question. And should I be doing that?
Well, I think the oral flea and tick products, um, with rare exception, absolutely not. And the rare exception is the dog that is so allergic to fleas that it will then, if it's not taking something to keep the fleas off and other methods don't work, um, this dog will end up on steroids, antibiotics,
Mm,
cyclosporine, and worse. Then it's like it's a better trade-off, I think, because the dog never experiences the misery of the allergic reaction. Now, for the vast majority of other pets, though, yes, I know it's so exciting. Yeah. For the vast majority of other pets, absolutely not. I mean, the FDA black box, meaning they put a literally made the manufacturers put a big black box on the back of the product that says, don't give this to dogs that may have seizures because we've seen an increased
mm,
incidence of seizures. Well, the other problem is, just think through it this way. And I think we talked about this when we met. You're giving your dog a anti-parasitic or a pesticide. There we go. That's the right word. You're giving your dog a pesticide by mouth. That pesticide has to work its way through your pet's bloodstream and be
mhm.
stored in the fat in order to be released over 30 days or 90 days in the case of, I think it's Bravecto. And then that stuff has to go to the skin for the flea to bite, for the flea to die. So that's scary. I mean, we've got enough scary stuff hiding in our fat cells to put a pesticide in there is just, ee.
Sure.
So, yeah, so not a great plan. And then a lot of people went to this because, oh, I don't want my kids touching the pesticide, from the topical stuff. It's still on the dog skin. Granted, it's not as big a glob at one time,
I
but
didn't
it's
even
still
think about
there.
that. Yikes.
Yeah, it's still there. I mean, if the flea has to bite the dog or the cat to die, it's
Right.
there. So,
So
yuck.
alternatives, yeah. So
Yeah,
so this Seresto collar you mentioned, what's its
right.
mechanism of action? And is that something the dog wears 24/7 then?
It is. It
Yeah.
is. And so, no, one of my group coaching clients is like, I just saw that there's a big class action lawsuit against the manufacturer of Seresto because it's killed 1,800 dogs. And this is true. The other problem is that for the number, like it comes down to percentages to some
Mhm.
degree, right? Because for the number of doses or collars that have been sold, it's something like 0.1 or 0.2% of dogs.
Sure.
But it's horrible if that's your dog. All of the other products, there are similar issues. So I was doing some research, and the problem is that the Seresto collars are using something called PFASs or forever chemicals, and these
Mm,
are, they're horrible. And as they sound, they are in the environment forever. The problem is, and that's yuck. They cause cancer. They do dreadful things. The issue is that if you live in an area your municipality has ever sprayed for mosquitoes, you have breathed, eaten, and drunk more PFASs than you will ever put on your dog.
hmm,
And in fact, the state of Massachusetts really has a crisis because their water is so contaminated with PFASs. So it's like,
hmm,
yuck. Um, all of the flea products, all of the tick products that are sold by veterinarians and sold over the counter in pet stores are pesticides. They have inherent risks. And so it's like, golly, what do we do? I
yeah,
mean, if you
yeah.
live in
Tell
Florida
us
or
what we
South
do. Yeah, yeah, what do we
what do we do? If you live in Florida and South Carolina, fleas are a big problem, and it is not fun if you have a massive outbreak in your house. So the things that are important is to do what's called environmental control. And you can do this with nematodes that actually eat the eggs and larvae. You can do this with borax, with diatomaceous earth, things of that nature. And then you can use things like insect growth regulators that prevent the flea from forming a molecule called chitin, which creates their skeleton, their exoskeleton, if you will, their protective layer. You can use things like Capstar, which is a tablet you would give your dog or cat if you see adult fleas on it. You can use an insect growth regulator that's given orally, lufenuron, which unfortunately is only available in the US in combination with a heartworm prevention. And really, even in Europe, they use it they feel very comfortable with it and with its safety. And then there's a myriad of other more natural options. So amber collars, literally collars made out of the stone amber,
Hmm.
um, zero bug zone, which are electromagnetic, create an electromagnetic field that repels fleas and ticks. You can
Now, is that
use
does that pose other dangers though? When I think of EMFs, I think, those like
it
from a computer, a cell phone,
right. No, and, so we're the only danger that I have seen thus far is for pets that have seizures, and so it can increase the likelihood of a seizure breaking through,
okay.
but as far as long-term health effects, I'm not aware of any. I've never seen any research to the contrary. In fact, I've only seen research about the safety of these products.
Okay, well,
So
you listed a lot of alternatives, so I need to research those. When you said borax, did you mean is that like this may be excuse my ignorance, but some of those products, are you saying we would apply those to our lawn or to our animal?
to the lawn,
Lawn. Okay.
right. Right. So, and a lot of people will give diatomaceous earth orally for fleas, but it doesn't work that way. And I think it just ends up really irritating the gut.
Sure.
So it works externally around the house. In shady areas is where fleas are going to be more likely to be, and then between the sofa cushions, under the dog's bed, the bedding cover, things of that nature. So these are all environmental treatments. So treating both inside the house and outside the house to limit the amount of fleas that can grow.
Love it. What was that wash that you mentioned that I said one of my patients had used that what was the name of that? I already forgot and I got to write it down.
Oh, the
It,
Wonderside spray. And in fact,
Wonder
again,
side. Yeah.
yeah, if you go over to my website, to
Yeah.
drruthroberts.com and just search for flea control alternatives or just fleas in general, I've written several blogs about that.
Awesome.
So there's
Awesome.
a whole
Awesome.
host of info. Yeah.
Okay. Last heartworm. Does my dog need heartworm medication every month?
No. And the American Heartworm Society actually says this. So they've gone back and forth. Um, Again, look at the incidence map of where you live. Heartworm is in almost every state. I think except for like Nevada and Arizona, they're truly desert states. But what the American Heartworm Association is now saying is that probably we can get away with every 60 days giving it
Hmm,
because of the life cycle of the heartworm itself.
good to know.
Yeah.
Good to know. This is all awesome. Thank you so
So
much. Yeah, yeah.
yeah, and so with that, I would give, when you give heartworm prevention, wait 24 hours and give something simple like ivermectin, Heartgard, or its alternatives. Um, Sentinel is the one that has lufenuron in it, but at any rate, the way they work, you give the pill, it's in the pet system for 24 hours, and then it's out. But post 24 hours, I would start on some milk thistle to help just kind of clean the
Sure.
decks. Yeah.
Sure. All right. I'm sure our listeners are just at this point thinking, holy smokes, because you've provided
Fire hose.
so much information, but this is all on your website. I mean, I could have spent hours on your website. You just have so much information there. I
Well,
do
thanks.
want to I do want to ask just a few things that I know you think are very important as far as in the society we live in. I know I talk to my human patients about this all the time, how important stress reduction is for us, but this is also important for our animals. If I think you believe this. So how can we incorporate some of that kind of mindfulness and meditation for our animals?
I think it's absolutely critical because if we're wandering around, we're wired to
Mm.
the gills, we can't relax, we're constantly checking our phones, our anxiety level is just through the roof. They're like, holy smokes, what is wrong with mommy? She is just nuts. So, what I really strongly recommend for all of my clients and folks that I've talked to over the years is take at least 3 minutes. Turn off everything that dings, turn off all the screens, preferably go sit outside under a tree and just breathe and relax with your dog and hang out for 3 minutes. If you do nothing more than pet her and tell her how beautiful she is and how grateful you are that she's in your life, that is going to do a world of good for you and for her. It is, but I mean, they're reading our energy, and our energy is like crazy frenetic. And unfortunately, I think the other problem is that pets become our emotional mirrors and also buffers. So they can reflect back to us like, you are really off your rocker right now. And we can choose to see that, or we can just kind of keep blowing past it.
Mm,
But they are showing us things about ourselves that we really need to pay attention to. And as we receive that information and act on it, our lives get better, their lives get better because they're less stressed. The other thing is that I have seen families that come in with the 3rd dog with lymphoma, or the 4th dog with hemangiosarcoma, or the
mm,
all of their dogs have blown their cruciates. And I am convinced that our pets buffer things for us so that we can
mm.
get a wake up message and go on to do what it is we're supposed to do in life. So I mentioned earlier that one of my dogs had bacterial endocarditis, and I firmly believe that she took the hit for me, and I prevented me
Mm,
from having a heart attack.
wow.
And that may sound a little crazy, but that's I've seen this happen with pets and other people over the years.
You gotta put the whole long story in a book. You gotta write a book with all this. Yeah. Oh, well, tell listeners where they can find you and kind of connect with the crock pet diet.
Right on. So if you head over to drruthroberts.com, that's the website. Go check out the blog. As Dr. Gray said, there is tons and tons and tons and tons of information there. And we've also got a really awesome download called, or PDF that's called When Not to Take Your Pet to the ER Vet. It is packed with suggestions of things that you can do at home for emergency situations that aren't quite emergencies. And it also is filled with information about, yeah, this is an emergency and you really need to go. Um, so we'll get you a link where you can just go sign up for it, get the download. And then also for listeners of the podcast, we will extend a 10% discount on the original Crock Pet Diet. It That title sort of belies what it truly is. It is recipes, it is cooking videos, it is an ebook, but it's also a weekly question and answer over YouTube where you can get information about how to tailor the diet to your pet in specific. And that's something that I do. And now that I've got my first class of holistic pet health coaches um, graduated, they'll start stepping in and doing some of those question and answer sessions as well. But I mean, for less than $100, this is a huge bargain.
Love it, love it. Thank you. I will post that link and code in the show notes. So, as we wrap up every episode, I always ask my guest their top longevity tip. So, what would your top longevity tip be? Humans, animals, or for both?
I mean, it's got to start with food. If you're eating
Mhm.
garbage, it's the old garbage in, garbage out. And next to that, it's taking time to slow down and appreciate where you are.
So good. This was wonderful. So thank you so much for coming on the show today and again sharing your original crock pet diet. I look forward to being able to try this on Lily, my miniature golden doodle. And thank you for being an advocate and an educator for us for the longevity of our furry friends. This was awesome. Thank you so much.
Awesome. My pleasure. Thank you.